A patient was operated for thyroid disorder, thyroidectomy. So parameters were normal on monitoring. On the same day around evening, patient developed pain and swelling over the neck. On exploration of the surgical site, bouts of clots were found. So what have happened to the patient? This is the question, and options are: one is primary hemorrhage, and the second one is reactionary hemorrhage, and the third one is secondary hemorrhage, and fourth one is malignancy. So the patient was operated for thyroid disorder. The treatment done here is thyroidectomy, and the parameters were normal on monitoring. On the same day around evening, patient developed pain and swelling over the neck. On exploration of the surgical site, there is a clots were found. So what is the reason? So let's see about individual options. So the first one is primary hemorrhage. So hemorrhage occurring immediately due to an injury or surgery comes under primary hemorrhage. So primary hemorrhage, it is a hemorrhage occurring immediately due to an injury or surgery, is primary hemorrhage. And what is reactionary hemorrhage? Delayed hemorrhage, that is within 24 hours, and is usually due to dislodgement of the clot by resuscitation, normalization of the BP, and vasodilatation. And it may also due to technical failure and such as slippage of a ligature. So reactionary hemorrhage, it is a delayed hemorrhage, and within 24 hours is called reactionary hemorrhage. Next is secondary hemorrhage. So it is due to sloughing of the wall of a vessel. So it usually occurs 7 to 14 days after injury and is precipitated by factors such as infection, pressure, necrosis, or malignancy. So the secondary hemorrhage, it occurs after 7 to 14 days after injury. So it is precipitated factors here is infection, pressure, necrosis, that is such as from a drain, or malignancy. So what is primary hemorrhage and reactionary hemorrhage and the secondary hemorrhage? So here the correct answer for this question is option 2, reactionary hemorrhage. Why we choose the option 2, reactionary hemorrhage? The key concept here is reactionary hemorrhage occurs 4 to 6 hours after surgery, and it is caused by ligature slippage and clot displacement or cessation of vasospasm, and after mobilization or coughing. So if hemorrhage occur immediately, it is a reason for primary hemorrhage, and within 24 hours, the reason here is reactionary hemorrhage, and after 7 to 14 days, the reason is secondary hemorrhage.